it to you first because Mumbai is where it all started. But in the last 3 days, we've seen numbers relatively under control in terms of cases. Some would say that's a function of test rate. But your general perception, is the worst over as far as Mumbai is concerned? Will we see the wave peaking in the next few days in Mumbai? Or is it already flattening?
Good evening, Rajdeep. I don't think it has already plateaued. I think we will see the wave coming up shortly into the peak in maybe a few days, maybe a week's time or so. If I look at the numbers today, the today numbers are again 18,000 plus with a test positivity rate of 24.3%. And what we saw the last 3 or 4 days probably was a combination of the weekend effect plus people who were doing home tests were not reporting their tests, and then probably now they have started to report, and they have also increased the testing in the last few days. I also see that possibly with the new testing rules by the government of India, where you are going to test only symptomatic patients, you may actually see a test positivity rate jump up very high, because right now if you look at the testing matrix, around 75 to 85% of the patients are completely asymptomatic in Mumbai. And if that means that we are going to only test symptomatic patients, we may see a very huge spike in the test positivity rate, though the numbers might remain more or less the same. Now let's come to the ground reality. Ground reality is with the physicians and the general practitioners spread across the city who actually have the pulse of what is happening at the ground. If you ask them and you talk to them, I was speaking to a few of them this morning, they have seen a dip of around 20% patients coming to their outpatient departments. And so have I seen around 20% decrease in the teleconsults and the flu OPD which are coming across. So I hope that this actually is a real dip in the cases, and we see that in the next few days, probably the numbers would remain same, and then we could say that the wave has really reached its peak and it's flattened out. So that's the ground reality. In terms of hospitalization, we have hospitalization increased slightly, which was expected. I was always expecting that it always follows the peak, follows the cases. So the hospitalization has increased, at least in the private sector. There are still lots of empty beds. More than 60-70% of the beds and ICUs are empty, which is a good news. But hospitalization, nevertheless, in the last 2 or 3 days, we have got more requests for admissions and more patients turning up to emergency department who are, again, incidental COVID is a big aspect, actually, rather than patients requiring oxygen. I have got strokes, I've got GI bleeds, I've got traumas, I've got all sorts of medical and surgical patients who are not respiratory patients who are turning COVID positive but requiring ICU care.
Okay, interestingly, you've given us a sense then of the good news and the not so good news. Let's turn to Delhi, because cases have climbed up in Delhi over the last few days, but I just heard the Delhi health minister claiming that he believes that the wave is about to peak. Dr. Chatterjee, is that a sense you get that again in Delhi, hospitalization still relatively low, but in the last 24 hours, 40 deaths have also been reported. How do you see the situation in Delhi? Is the worst over?
I still don't think that the worst is over, but what I'm expecting is in the next couple of days we might just peak, because I would say that today or yesterday, as the previous speaker said, that even in Delhi I could see less number of calls and less number of people who were trying to come to the hospital. But yes, hospitalizations have increased in the last couple of days, but still we are left with a lot of beds in the hospital. They are not over-occupied the way it was in the second wave. What I can see is in the next couple of days, Delhi might peak and then the downward trend might start. So I would agree with the health minister at this moment that this is what we are watching. Even at the ground level, we are seeing that the levels might just show a downward trend in the next couple of days.